Hello, George.
Hello.
Nice to meet you here. And could you please introduce yourself?
So my name is George Nicolaou. I born in Paphos here, and I'm a physiotherapist for the last 23 years now.
23 years.
Yes. So I'm working in this field a long time, say.
I saw a lot of diplomas here.
Yes, it's true that all these years I have been busy with educating myself and also with getting new knowledge that will, let's say, help my patient first. Because if you want to work at this field of health, you have to be up to date with everything new and also with all kind of new technologies, but also new kind of treatments that there are in the field now. Yes.
Great. Could you please show us your clinic and?
Of course, yes. First here, that's my office here. So when somebody is coming, the first place we meet is this space here, because we have to talk and take some really
story of...
Yes, the story of the patient is, let's say, it's really important to take a good story and know what's going on with the patient, so you can proceed to a kind of a good treatment and effective treatment with him, or her. So everything starts from here. We take the history of the patient and we meet each other, because you can, you can have a good contact with the patient before the treatment starts. So that's really important. Also about the impact between me and my patient. Yes.
Great.
So let's see the other places. At the waiting room. So that's our waiting room here. Nice view, as you see.
Yes.
Paphos view, Paphos sea area down there. Yes.
Great. See you also here.
Yes. Okay. And as I told you, after, let's say, we take the history and we understand, let's say, what's the matter with the patient, which kind of treatment we are going to have, we can proceed to a different kind of treatments here. And you can see this is here the treatment rooms. Actually, here we have a patient now at the moment doing electrotherapy, electro treatment here. Yes, and also we can have here what we call shockwave therapy.
So, George, tell us, please, which patient can come to you, with which problem you can help manage, and how it's usually work?
So as I told you before, mostly here in our clinic we deal with orthopedic problems that they have to do with musculoskeletal system. We speak about bones, muscles, all of these, And of course, we have a kind of patients from all the ages, start from really from the childhood and could go until let's say a kind of elderly patient, yes. And all these group of ages, they have, as you understand, different problems. The children, let's say, will come here because they have a fracture or something, so they need rehabilitation after. As we get older, the problems are mostly that we get are the wear and tear problems. Let's say arthritis. Arthritis is one very common, let's say, problem for people, elderly people, to come here and ask for help, especially the knees are a kind of joint that very usually has this problem, arthritis. Sports people, they get muscle injuries, they come here for treating their muscles, even massage, for kind of recovery massage many times. And also, actually, we have many people coming here regularly, let's say once every 2 weeks, once a month, once every 2 months, depends on the situation, just for maintain themselves in a good condition and their body in a good condition, and keep helping their problems long term.
Great.
Yes.
Great. George, and do I need to do some diagnostic before come to your clinic, or you can do that?
Okay, that really depends. Many times, yes, many people, they have to do, they have to visit the doctor before and have an imaging, like X-ray, and after the doctor's diagnosis to come here. But many times, if people, they have a chronic problem that they know what's going on about it, and they know how they can help that problem, and actually physiotherapy is one of the treatments that can help their problems. They come straight away here. Of course, we can assess them. We can check, let's say, the problem and see how we can help it with our knowledge, with our, let's say, treatments here. And of course, if it's able to do it without having any kind of, let's say, visiting to a doctor or to an MRI center before, we can treat it. Otherwise, if we see that it's something that it's out of our field, we can send them back to their doctor, and so they have a further investigation about the problem they have. Yes.
Great.
Come here to the second treatment room. And here is the TEGAR treatment. The TEGAR treatment actually is radio frequency treatment. It's a kind of high energy current that is penetrating really deep and stimulates the blood circulation, also activates in depth the cells work, and it's really, let's say, effective for many conditions like muscle spasm, like backache, neck ache. Actually, does not have many intraindications, so we can use it for a lot of conditions, and is going, let's say, to be very helpful if we combine it also with manual therapy, because always movement in combination with this kind of treatment is giving better results. And the other very important place we have here, after, let's say, we finish with our physiotherapy treatments, always to maintenance these results is to continue with exercising, therapeutic exercising. So we have here a rehabilitation gym that could be used for our patients after they finish their treatments for, let's say, strengthening their muscles, recover faster, and keep themselves in a good, let's say, condition. We can go and have a look there now. So this is our rehabilitation gym, and as you see, the space is, let's say,
Quite big.
Quite big, yes. We have many things here that could be useful for training and especially after surgeries. Many patients, they need to continue with exercising for rehabilitation and have a program with kinesiotherapy or strengthening their muscles, because, as you know, after a kind of surgery, the muscles are not function so well, so they get weak. We have to get them back and make them, let's say, stronger and functional again. So we need, every physiotherapy clinic needs a space like that for, let's say, continue the process of rehabilitations after physiotherapy, yes.
A lot of different equipment and very interesting zone.
Yes.
And special exercises.
Actually, we have here, we work here mostly with functional exercises, exercises that they help people to deal with the everyday life, okay? Not so much with people they want to build their bodies, but with people that, let's say, they want to go over a problem and get strong again to continue their normal activities and their normal, let's say, way of life. Yes.
Great. Could you please tell us, George, about your life way and why did you choose this professional as a doctor, as a physiotherapist?
Yes. Yes, now if I go back and remember how I chose that, actually for me was let's say, nice that I'm going to work with sports people or athletes when I deal with this profession. And so I decided that I have, let's say, a good opportunity to work with all these, interesting people if I finish that study. And yes, it's true, when I finished my studies, I worked also with football teams and sports people. Slowly now, mostly my field is the orthopedic, let's say, medicine. So I deal with patients having orthopedic problems like spine, neck, lower back, knees, hips, all this kind of condition. But I never regret actually that I studied this kind of profession, because it was all the time, from the time I was studying until now, every day you have a new challenge. You have new patients, they come here, they tell their problems, and every single day you have a new challenge. You have to think how to help all of these people to go through their problems. Yes, so it's really nice. I do that.
Great.
Yes.
So, George, could you please tell me what the main ideas, the main meaning you can put in your job? For example, it could be responsibility, or maybe for you very important to do your best. Tell me about the main idea when you're thinking, when you try to help your patients.
Okay, yes, if you come, let's say, about helping the patients, it's really important for me to, let's say, get deep into their problems. Not only the problem that they come here, but sometimes, many patients, they come here and behind their problems, there are somatic problems, it's hiding something else, maybe psychological problem that could affect the, let's say, their body. So you have really to have a good contact with your patients. So I put this really high, in really high position, because understanding what's the matter with the patients will lead to the best treatment, to the best solution of the patient's
Great.
problems.
Yes,
Yeah.
it's very important.
Very important, yes.
Yes, and could you tell us about some life crisis, if you had in your life maybe, and how you can escape from the hole, and what helped you to do it best?
So yes, if we speak, let's say, about my job here, I can go back to 2013 when we had here the financial crisis and the bankruptcy. And that time was really bad for everybody here. So also my job, my work here was not so good at that time. And it was really, let's say, worrying, because after all these years, it's like you see something with, and you think if you are going to have a kind of future in this profession, in all you did until now. So that was really stressful that time. And yes, if I go back, I remember this as the worst time for my business. But you know that people, I want to mention that when they are in front of a big threat like this, like it was, they help each other. So I think we helped each other to go through this. An example is that my landlord here at that time came and said that, okay, your rents, they are going down because of this crisis, so you can stay here and fight and go through this. So that's an example about people that they help each other to go through a situation.
Yes.
But also the coronavirus was a really bad period. Coronavirus also because we had the, yes, we have to stop our activities, everybody. And we had the lockdown, of course.
Yes.
And after, let's say, a month, we started to think, are we going back to our normal life again or not?
Oh,
you
not,
know,
not
yes,
never.
yes, because
Yes, it
was really that time we didn't know how to even we couldn't accept patients here because we didn't know what this thing is, let's say. So it was really, really bad period for everybody, of course, not only for. But I remember these two periods that affected, let's say, our lives, of course, but also our jobs a lot. But as I told you, I think you find the strength to go ahead and let's say go through any kind of difficulty if you believe that you are going to make it. Yes.
Yes, you're absolutely right. It's very important to believe in the great idea who can give you some power and to help with your patients and you everything. And you also, I think, you every time, every day's job, it's not only physiotherapist. It's like give some hope and
exactly. The other, I forgot to speak about that. Yes, it's your patients are giving you, let's say, the power to go on many times because you see that you help them. So you feel that you are doing something good, something that is helping other people, and this is really something really important. Is giving you the power to go on. So yes, and as I told you before, the relation I have with my patients is really, let's say, good. It's really important to get this close relation so you can help them even more. And help people is really important. So this helped me a lot, not only solving situations in my job, but generally in my life. Yes, yes.
Thank you, George, for your time, for your sharing your stories, and for your job, of course, because you really help a lot of people and you change their life of your patients. And he was something like, if we had some pain, we can't think about anything, just nothing, just the thinking all times about the pain. But when you help us, we can do a lot of.
It's true, yes. It's true that, let's say, many times you can't heal, cure everything, but it's really important to give to the people a kind of relief, to come and to have this feeling that you help them.
Yes.
Even many people, they have problems that they cannot be cured, you know.
Yeah.
But they need of relief. So they come here, and if you can offer them relief, they will be pleased, and also you will be pleased with this. Yes.
And I think you made your patient your friends often. You have some
yes, of course, many times, yes, that could happen, yes. But generally, we have a really nice relation. Even we are not, let's say, close friends, but we have a really nice relation with patients. Yes.
Many years.
Yes.
Because it's also the family comes, the friends.
Yes,
comes,
of course.
it's
Yes,
like big
it's
family.
something. As I told you, all these years I'm working, I have patients coming maybe for 20 years.
Yes.
On and off, of course,
Yes.
but so after so many years, it's really amazing. I mean, it's
Thank you, George.
Welcome, Natalia.